American kids lack ideal cardiovascular health, aha. A large proportion of American kids fail to meet standards set for ideal cardiovascular health, the American Heart Association, AHA, said in a newly released statement. AHA said kids often lacked heart-healthy diet and physical activity essential to ensure optimal cardiovascular health. A huge majority of kids score poorly on dietary measures and only 1 in every 3 kids get sufficient amount of daily physical activity. Researchers found that less than 1% of kids in the age group of 2 to 19 years had a diet score comprised of the 4 or 5 components necessary for a healthy diet, and 86% of boys and 83% of girls had a diet with none or merely one of these components. When it comes to physical activity, 48.9% of boys and 34.7% of girls in the age group of 6 to 11 years got the recommended 60 minutes of activity a day. But, just around 10% of boys and 3% of girls in the age group of 12 to 15 years got the recommended amount of daily physical activity. Co-author Donald Lloyd-Jones said pediatricians can play a key role in helping correct the behavioral metrics involved in ideal cardiovascular health. Speaking on the topic, Lloyd-Jones said, "They have the power, along with the schools and public policy, to really help reverse this epidemic. If we can improve eating patterns and increase physical activity among children, we can dramatically alter their life course." According to AHA's 2010 report, the ideal metrics are, never tried or smoked a whole cigarette, BMI less than the 85th percentile, at least 60 minutes a day of moderate to vigorous physical activity, healthy diet score on 4 or 5 components, blood pressure under the 90th percentile, total cholesterol less than 170 mg/dl, and fasting blood glucose less than 100 mg/dl. According to a story published on the topic by i4U News, there are 7 basic factors that determine whether a child's heart is in ideal condition, and they include having a healthy body weight, getting enough physical activity, not using tobacco products, and eating a healthy diet that helps maintain healthy cholesterol, blood pressure and blood glucose levels. Lacking 1 or 2 can result in poor heart health. Surprisingly, only 1% children were found to meet the organization's criteria of ideal cardiovascular health. A primary reason for so few children having ideal cardiovascular health is poor nutrition. Children are eating high-calorie, low-nutrition foods and not eating enough healthy foods, such as fruits, vegetables, whole grains, fish and other foods strongly associated with good heart health and a healthy body weight. Engaging in these ideal health behaviors early in life can have a tremendous benefit on maintaining ideal health throughout the lifespan. Instead of taking a wait-and-see approach by treating disease later in adulthood, we should help children maintain the standards of ideal cardiovascular health that most children are born with, according to a recent Inquisitor News report. Not even 1% of children between the ages of 2 and 19 had a suitable diet score in 4 out of 5 categories necessary for a healthy heart. When it came to the amount of physical activity necessary for heart healthy, just under half of boys and 34.7% of girls between the ages of 6 and 11 reached the goal of moderate to vigorous physical activity for 60 minutes each day. Between the ages of 12 and 19 the numbers dropped even lower, with less than 1 in 10 boys and only about 4% of girls getting the recommended 60 minutes per day to achieve heart health.